All right, I think it's about time for us to get started. So on today's call, we have Larry Carter, President of Louisiana Federation of Teachers, who will get us started.
Well, first of all, good afternoon, everyone, for joining us. We're so very excited to introduce a presentation today on the findings of the Louisiana Federation of Teachers School Employees for Reopening Schools 2020. We did a survey over the last week to get a finding of what was the pulse of the community, teachers, parents, on reopening schools this coming August. And I'll ask Heather Cushman, who's our senior media specialist, relations manager rather, who will go through the actual document, and then we'll certainly open ourselves up for questions, and you can ask as many questions as you would like, and we will certainly be willing to answer those questions. But we wanted to give you a snapshot of our findings, and I know Heather produced the document so you can peruse it at your own time and leisure. But without delay, I would like Heather to go over some of the highlights of our findings. And I think you'll kind of see how individuals in this community, both parents, teachers, school employees, and parents, what are their thoughts after the survey findings? We were really enlightened, and so we'd like to share that with the rest of the community. So thank you for joining us, and Heather, you can start.
Thank you, Larry. Hi, everyone. As Larry said, my name is Heather Cushman. I work with Louisiana Federation of Teachers and School Employees. I have just sent a PDF document on the chat that is a in-depth analysis of our full survey results. It will be posted on our website following this call. Once we finish here, I will reference back to it as I go through in general the results that we found, but if you have more in-depth questions about specifics in the survey, they can almost certainly be answered in that document. So with that, I want to just go over that this survey was open to any Louisiana resident, and we got teachers, school employees, parents, students, and concerned community members. We had almost 15,000 total responses, 57% of which were current school employees and 43% are not current school employees. So those are two categories that we use to analyze the data more in depth. So I'm going to define a little bit more who is actually in those categories and then go through the results that we found. You can see that the results were collected between June 30th and July 10th. So yes, the survey closed on Friday, so it's as up to date as possible, but of course things are changing quickly. Every day we see new updates with regards to this issue. So first off, you can see that when we talk about school system employees, we're talking mostly about teachers. That's who overwhelmingly responded to the survey. 10% were paraprofessionals, and then another 18% were different school employees. And those categories are broken down more specifically in the report, but you can see that's librarians, substitutes, school administration. But again, overwhelmingly, we're talking about teachers when we talk about school employees. And those teachers and other school employees are more predominantly serving younger children, but it's relatively well distributed. And you'll note that these percentages for these categories don't add up to 100, but that's because it was a check all that apply option, because of course some teachers will serve pre-K to second grade and also special needs kids. And sometimes they'll serve a gambit of different ages as well. So it's also important to note that the majority of educators who responded to the survey were also parents. Almost 60% of our teachers and school support staff are parents themselves. So when they consider the questions herein, they're really looking at it from two different perspectives. Now, when I talk about non-school employees, of the 6,444 non-school employees, overwhelmingly, we got responses from parents of children who are currently in Louisiana school systems. And then if they weren't parents, they were mostly either active current students or grandparents of current students. And then the other was pretty much just retired teachers or concerned community members. But again, considering how many of our educators are also parents and how many parents responded to this survey, overall, we're looking at 72 total respondents on this survey are parents. So it really gives us a picture of what parents are most concerned about coming back to school. The first question we asked school employees was, are they at an increased risk for severe illness due to COVID-19? We asked them to respond both for themselves and for anyone in their immediate household. You can see that 42% of our school employees are either at increased risk or are unsure of whether or not they are at increased risk. And that's specifically because they are either over 65 or have an underlying health condition. And the survey did link back to the CDC guidelines on what constitutes an underlying health condition that puts you at increased risk. When it comes to households, we see even bigger numbers. 51% are either at increased risk or potentially at increased risk. So we did also ask both school employees and non-school employees to rate the importance of a variety of precautions on a scale of 1 to 5, 5 being extremely important, 1 being not important. And I will let you all dig into this in more detail in the report, but the main takeaway for me is that everything is important. All of these safety precautions that we asked about, people marked as either important, very important, or extremely important on average. So you can see the specific scores. We averaged them as well as put the amount of people who responded to each one. So we asked school employees specifically about working from home. And you can see the results that 45% would prefer to work from home if given the option, whereas 34% would return to school. But I think it's important to recognize that a lot of people gave a caveat to their answer in the additional comments or other field of this question. Specifically, what we saw again and again was that people wanted to return. In an ideal world, they would be in school, but they caveated all their answers on either they wanted to return, but only if safety was assured, or they wanted to go back, but didn't think they could be safe. We asked both school employees and non-school employees about how their school district has communicated with them about back to school throughout this process. And again, percentages won't add up to 100 because this was a check all that apply, but we could see that 46% of both school employees and non-school employees, because this data that we're shown here is a combination, simply do not know what their school district is doing to prepare, which is of course a concern because we saw in the results about what is most important that the majority of folks said that it was either very important or extremely important for school districts to consider the input of teachers, support staff, and parents in making these decisions. We did also ask about technology, what technology child has access to at the home. Those results, we just asked the parents and community members, the family members of children who are actively students. And most of our respondents have strong internet and a tablet or smartphone with strong internet. And we are aware that this survey was conducted electronically, so that might have skewed the responses on this one, but it is promising to see that most of our students have at least a strong internet connection, regardless of which device they might be using. So then we asked both school employees and non-school employees if they think that school buildings should reopen this year. And this is a combination of the responses. You can see broken out in the report that school employees were less likely to support reopening, but overall in either category, there are a lot of mixed answers here. So 27% said yes, absolutely. 24% said that no, learning should be 100% virtual. And there were, the most said mixed, that there should be both in-person and distance learning options available. But you can see that folks are really torn up here. There's a lot of mixed opinions about whether or not school buildings should reopen this year. And then this, in my opinion, is the most telling question. Given what you know now, are you comfortable with your children or students returning to school? And the majority of parents and teachers do not feel comfortable with their own children returning to school, given what they know now. Almost 60% on average do not feel comfortable with their own children returning to school right now. So then, as you'll see in the report, we did break it down by statewide COVID-19 regions. And there's a more in-depth analysis of each specific region in that report. But I'm going to go through some of the main takeaways. When you look at health risks by region, again, this was are you at increased risk, or is someone in your household at increased health risk due to either age or pre-existing condition? You can see that there isn't a huge distinction by region. New Orleans area reported higher rates of risks for themselves and household members than some of the other regions. But again, it's relatively consistent. The percentages only fluctuate a little bit. We did also break out important precautions by regions, so you can dig into, and it's probably hard to see this slide from your computer screen, which is why it's in the report. You'll be able to see it more clearly. But I just wanted to note that what we did here in order to develop these charts and this look was we looked at the average rating on the scale of 1 to 5 and compared that among the different districts. So that's what you're seeing here with the 3.77 or the 3.89. That's an average of the total score folks gave. When we look at how the school district has communicated with school employees or parents by region, we can see that 62% of Northeastern Louisiana do not know what the school district is doing. So that's a pretty staggering number. If we look at Region 2, the EBR area felt excluded from decisions and discussion regarding reopening of schools. And in Region 1, the New Orleans region, we saw that most folks have been surveyed, and I attribute that to a survey that Jefferson did quite widely to evaluate concerns of their teachers and school employees regarding back to school. And we look at if school buildings should reopen this year by region, we can see that regardless of what region we're talking about, there isn't consensus. If you look at the river parishes in Region 3, there's a lot more mixed opinions asking for mixed both in-person and virtual options to be available. In the New Orleans region, more folks said that they hope school does not reopen. But again, it's pretty mixed no matter where you look. And then last but not least, I wanted to highlight that in no region in Louisiana do the majority of parents or school employees feel comfortable with their own children returning to school right now. Given what they know now, they are not comfortable with their children or students returning to school. So again, I will send the report one last time just for anyone that joined after we get started and didn't have a chance to see it. But with that, we will open it up for questions. We just ask that you raise your hand if you open the participants window, and then at the bottom of the screen, you'll see raise hand. And then we will one by one call on you to answer questions. Unless no one has a question. Okay, we have a question from Paul Dudley. Paul, please, unmute yourself and go ahead.
Hey everyone, Paul Dudley here from WWL-TV. Just curious, I joined a few minutes late. Sorry, I was getting the password situated and everything. What is sort of your position and your takeaway regarding this survey? What are sort of the summaries in your sort of takeaway from it?
I'll start by saying we get a takeaway that unless there are necessary precautions and mandates that speak to social distancing, that speaks to disinfecting classroom on a regular basis, that speaks to wearing face coverings, parents and school employees just don't feel safe going back into the classroom and into schools.
And I am going to ask that if you're not the person speaking, please go ahead and mute yourself. We're getting a little bit of feedback.
And a follow-up, if possible. And so, are you confident that these precautions will be taken? That there will be enough resources for all of these things to take place in the schools?
Paul, I can tell you that's one of our greatest concern and have been probably since we started after COVID-19 hit our state is what kind of resources will be needed to adequately open schools safely. And right now we can say there's not enough investment at the national level into states and our local municipalities to make that happen. So we are very concerned that we do not have the necessary resources and funding to provide those resources to school districts so that we can see the protective gear in school. We can see the abilities of schools to go on any type of mixed schedule and have, in terms of bus drivers, if you have to reduce the numbers of students on your bus, that means two things. You either have to do 2 or 3 more routes to get those same numbers of students to a particular school building. And so therefore you're gonna have to increase your load in terms of pay to that particular employee, or you have to hire an additional bus service or bus company. And then when you talk about classrooms, where if we're in phase 2 or phase 3, you reduce the class size plus do social distancing, you're talking about an additional staff as opposed to a detraction of staff. So we don't see where there's adequate funding right now, statewide, being put into the school districts, let alone from the federal government right now. One of the sources we've been pushing for the last probably 2 or 3 months is the HEROES Act that would give us the resources necessary to fund reopening schools safely with applying to the federal government, states and municipalities could actually fund adequately opening schools. And because that is stuck in the Senate right now, with Mitch McConnell and his supporters, we're going to find ourselves not being able to open schools safely come in 2 or 3 weeks from now. So we're very, again, fearful of reopening schools and not having the adequate supplies to do that.
And I would just like to add that for those that don't realize, the HEROES Act would provide $1.5 billion in education funding for Louisiana specifically. That would be a huge number for us to figure out how to implement these appropriate safety protocols. So our next question is from Lee Goudroy. Did I pronounce that correctly? You can unmute yourself and go ahead.
It's Lee Guidry.
Hi, sorry about that.
Okay. I'm with the Daily Advertiser in Lafayette. And this goes a little bit to what you were just speaking about, I think. But what does LFT want to happen next with this information? Now that the survey is being released and the results are done, what is the hope that comes out of this?
We would hope that on tomorrow, Bessie makes a decision to have mandates and protocols that would specify what school districts will operate and how they will operate. I think when you look at the past probably 2 or 3 weeks, even 4 weeks, there's been a lot of guidelines floating around, but nobody's at this point stepped up to look at real policies and real protocols that speaks to really safely opening schools. So we would hope that tomorrow Bessie starts that journey in doing so, and alongside with the Louisiana Department of Education. And then we would hope though that there's mechanisms to have community and education stakeholders input. I know tomorrow there'll be a first shot at it, but at every school district in this state, there should be mechanism by which parents, teachers, community people can act, and even students for sure, engage in reopening and looking at the data surrounding the science behind reopening, not just the political rhetoric around reopening.
Does anyone else like to ask a question? You can raise your hand by opening the participants window. Just hit participants at the bottom of your screen, and then you'll see raise hand as an option at the bottom of the participants window. I see Ian Azim. Ozan. You have a question. If you can unmute yourself and go ahead.
Yes, thank you. I spoke with a teacher this past week, and her big concern was, what will the school districts do in terms of sick days in the event teachers have to quarantine? If a teacher has to quarantine for 2 weeks, she was concerned that they would go through all of their sick days and then some just in that one quarantine period. The other concern was, where are substitute teachers going to come from? How will school districts find teachers? What is the LFT doing right now in terms of ensuring teachers have adequate sick days in the event they have to quarantine? And what is the LFT doing to ensure that school districts have an adequate number of substitutes should something like that happen?
Well, Ian, I think that's part of the conversation too about resources, but I can tell you as part of the federal government guidelines to the CDC, if individuals happen to get COVID virus and at work, and they have to be out in quarantine for the 14 days, then we're pushing that they do not have to use their own personal days. And so that's why that conversation at the local school district level is happening, ongoing, and we're making sure that they follow the federal guidelines as it relates to that. And then in terms of substitutes, that's going to be probably one of the biggest issues that I think most school districts will face and school boards will face, because I don't think you're going to have a lot of people trying to run into buildings if they don't feel safe. And then when you have individuals who don't have the opening training for when they come into schools, like teachers and school employees, when they first go to school, they go through these trainings to educate themselves on the reopening policies and plans that the districts have. And then the CDC guidelines are relating to that. And then protocols, hopefully once we get that from Bessie and the Louisiana Department of Education, that someone just coming in on a rotational basis may create an issue for that school system as it relates to COVID contact. So I think that's going to be one of the difficulties of reopening. And when you start having, if you start having individuals needing to be quarantined for up to 14 days or 15 days. So I think that's one of those resource questions as well.
Thank you, appreciate it.
You're welcome.
Hi, this is Cynthia Posey. I'm the Legislative and Political Director with the Louisiana Federation of Teachers. And I don't know, to the first part of your question, I don't know if you saw the House Education Committee meeting that was earlier today. Superintendent Brumley did speak to that. He said that if a teacher has to go into quarantine, then they would use the federal days, the COVID leave days, so to speak, which are 10 days, basically 2 weeks, that they would use that. And then afterwards, they would be required to use their sick leave. He said, in essence, that it was the same thing as if they had caught cold or something like that. So that's apparently the position that the Bessie and the Department of Ed will take on that.
Thank you, Cynthia.
Thank you, Cynthia, appreciate it.
Okay, our next question is from Elise Corville.
I apologize, I had to mute myself. Can you kind of maybe explain the sick days versus teachers and students, just kind of like one more time, about if a teacher is sick, will that teacher, of course, have to quarantine? What will happen with the 14 days? And also if a student does become sick, will everyone in the class also have to maybe quarantine?
Cynthia, you can take the first part. Sorry.
Okay, so it was interesting to listen to what Superintendent Brumley had to say. In essence, that if, that he said that just because one person had tested positive, it didn't necessarily mean the whole school would be shut down. And so apparently there's going to be some type of, to scale as far as the perceived contagion, I guess. Again, all that's really unclear, and that's part of the problem. There are so many unknowns. our districts, we, as of yet, we don't have the guidelines from the state or the mandates from the state. So our districts haven't put out their final guidelines. And then, of course, when you look at what Bessie is proposing, and they put that out last, I think on Friday, it's almost as if they're saying that, well, this is what we want you to follow, but if this, to the best of your ability. So it's almost as if they have loopholes to get out of. So, again, I think the problem is we don't know enough about it. We don't have the resources to handle it. And even when we get the guidelines or the rules, policy from the districts, it's going to take time to implement that, because everyone from the principal to the janitor to the bus driver and all in between are going to have to be brought up to speed on that, because that's going to be necessary to ensure the safety of our children. So I would hope that we would look at opening schools back until at least after Labor Day.
Well, and if I could, sorry to interrupt you, Cynthia. I was just going to add too that when we talk about federal days, it was the CARES Act passed in Congress that provided some safeties for employees from all different industries who need to either quarantine or just can't report to work because of exposure to COVID-19. So teachers do have those protections as well, but we don't know what that looks like in practice. Specifically, if they're going to be, if they've been exposed, but they're healthy, should they be teaching remotely? And I think it's absolutely imperative that we provide options for students that have been exposed and are therefore stuck at home so that they don't fall behind during those 14 days. But those are not questions that we've gotten answered to on the state level fully. So we have another question from Amanda Roberts. Go ahead and unmute yourself and ask your question.
Hi, everyone. Thank you so much. Amanda Roberts, reporter with WVUE here. Was just wondering what the LFT thought about the results of this survey. Was it something that was to be expected, or what particularly was learned new about it? And then where do we go from here?
Yeah, I can tell you it was kind of expected in terms of the conversations we've been having for the past maybe 2 months, and hearing from individuals in different communities where we have staff and we have local affiliate leaders at. And to have it codified into numbers kind of opened our eyes to say this is something that we have to really speak about and use this data and information to share with as many people as possible, especially our decision makers like the governor, politicians, school superintendents at the local level, state superintendent, as well as those at the national level. And we're certainly planning to do that as we represent the state of Louisiana for fighting for the HEROES Act or whatever new funding stream that's out there to help support state and local governments from the national perspective. So we will certainly use this data to kind of guide our discussions. But it was kind of eye-opening to kind of see how there is this appetite to return back to school, but with having at least safety measures put in place that can almost guarantee that I won't go into an environment that's already tainted and not given a real safe approval stamp, so to speak. So that's kind of what we've been hearing, and this data that we've captured from around the state kind of solidifies that discussion and those discussions over the past 2 months. And so to have the information at our fingertips and to be able to share that, I hope will help us guide our discussions moving forward as we talk about reopening safely. And then the next step to that, really, that should have been probably almost 2 months ago. How do we fund safely reopening schools?
Thank you. Our next question is Eric Bell. You can go ahead and unmute yourself and ask your question.
Yes, ma'am. I hope everyone is having a blessed day today. Question is, for the kids that are going to be at home and the parents that have to work, is this something implemented as far as child care or something for the parents that do have to work and the kids that are at home because maybe they're susceptible to, diseases are prone to catching the virus?
Look, I think that's one of the areas that when you look at our survey that does speaks to this dichotomy that you do have different situations and people looking at it from different perspectives. And this is one of those perspectives that often, kind of get pushed aside in some areas, in some arenas, but we want to take that one on too, because I know there are school districts across the state that have options for parents in your particular situation or someone like that particular situation you just described, and that the parents can opt to have their kids stay home, and they'll get a teacher assigned to assist that student with distance learning. But in terms of once the two parents have to go out to work and that student is there, especially if they're under 10 years old or 12 years old, that's where the real problem starts, because it then becomes the responsibility of, I'm assuming, the state or the local school district to figure out how to support a parent in that situation. And it could be very difficult to solve, but I think that's going to be some of the toughest decisions that school districts at the local level is going to have to address. And I think by engaging as a parent with your issue at the local school district site level and at the school site level, is going to be really important for your voice to be heard, as well as I know we're going to amplify that as well.
Thank you for your question. I don't see any, or did you have a follow-up, Eric? I see you unmuted yourself again.
No, ma'am. I just wanted to say thank you.
Okay.
Thank you for the question, Eric. It is one that we've gotten quite often over the last, I'll say, 2 or 3 weeks, when we really get this discussion around how close and how soon will we be able to reopen schools. And right now, the issue of first responders, we have nurses, we have doctors, we have grocery store clerks, we have bank clerks, we have bank representatives, we have individuals who are working at, let's say, Home Depot, or working at Lowe's, or working at those places where we frequently go to, that they don't have the option of staying home with their kids. And so they're asking these questions as well. So we got quite a few of that ask of us as well. How do we help, I guess, echo or fight for those individuals as well. And so we're certainly going to use this conversation to continue to do that fight for parents as well who have that particular issue at hand.
Yes, thank you, Eric. I don't see any more hands raised at the moment. If anyone else has a question, you can either raise your hand, or I see Kevin Gautreaux from Louisiana Public Broadcasting. Did survey respondents have opportunity to submit their questions? We did have an additional comments box, which we have begun to go through. There were a lot of different perspectives and additional concerns people added to that. So some people did use that as an opportunity to submit their own questions. We have also been encouraging members and other concerned community members to submit questions directly to Bessie. There's a link of that on our website that they can click to use that to make it easier to send a question directly to our decision makers. Kevin, we will be sharing that information once we're able to distill it down. Again, these results came in on Friday, so we were able to put together a report over the weekend, and if we can figure out some main takeaways from that information, we will be releasing it. But the overall concerns and questions that we saw are, similar to what we've been hearing throughout this entire time, and to exactly what you all are asking as well. Any additional questions? Please raise your hand or write in the chat if you have any additional questions.
Yes. Okay.
What would be ideal time to let parents know what is happening from school districts? Asked Elise Corville.
I think the ideal time probably would have been a month ago, honestly. At least a month ago, so that you'll have at least another month and a half to prepare for the decisions that you may have to make as a family as to how you want to see your child educated, and then as an educator and a school employee to see how you would re-engage going back to school. Because there are, and I know you're going to hear these numbers at some point, in Louisiana, it's probably 20% of the workforce, particular teachers I've heard that is over the age of 60. And they would fit into that category of employees that really are afraid to report back to work because of some, underlying health circumstances or conditions that they may have. And then you have so many in different parts of the state that have kind of articulated how, while I may not have the age, I may have a pre-existing condition that makes me more susceptible to the COVID-19 virus, as in, heart disease, coming back from cancer. They may have, diabetes. And so all of those precursor conditions that make them vulnerable to the coronavirus. And that's what we've been hearing for a while now. And the survey kind of, when people ask those questions, we saw a few of those, but we'll do more of those writings that, and even in our chats and our social media outlet, you'll hear this grave concern for returning back to school. Teachers and school employees want to, but they want to do it in a manner that's safe for themselves as well as their students and parents and anyone who crosses the threshold of the school building. And because this is an issue that people on all types of, like information tracks, because there's so much misinformation, and then there's so much information that to have it in a one shoe fits all, one size fits all, it's just not going to happen. We know by regions, there's COVID hotspots in our state, and there's in certain parts of our state, there's few cases. But what we're all hearing is that in Louisiana, there's hotspots that's now turned the corner. And then there were cases places in our state where there were no to little case numbers of cases, to where now they're becoming more of a spot to be looked at as a hotspot in the near future because of relaxed behavior in certain parts of the state. So we're concerned that, of course, it can't be a one-size-fits-all approach, but we have to make sure that when we have an approach to reopening schools, it should be done in a way that's safe, that speaks to the needs of that particular community, and also speaks to the needs of children and school employees as they are being put on the front line to return back to school. If they're not in a safe environment, we would be very, very concerned about that. So again, the funding part hasn't been talked about a lot, and that's an area where we certainly would like to continue our push with legislators, the governor, and as well our senators from Louisiana to push to make sure that we get the national funding needed to reopen schools safely, and not just to be reopening schools for political purposes.
Okay, I think that we have 3 questions left, and then we're going to wrap it up. So we're going to go first to Eric Bell, and then Nancy Torredine, and then Elise Corville, and then we will wrap it up for the day. So Eric Bell, you can go ahead and unmute yourself.
Yes, ma'am. One more quick question. This is a concern from my 9-year-old daughter. As far as from pre-K to 8th grade, how or if there's a plan effective as far as keeping masks on children? Because, I mean, I've seen examples where kids had the mask and then they put them on the hats for the hats and, put them around the ears. So it really wasn't effective to them. So how could they, or if they do have a plan implemented as far as keeping the child healthy or safe?
Yeah, that's one of the major debates. I'll be honest with you. It's really taken me by surprise in some cases when we think about it as a health issue versus a political issue. Health-wise, and following the science, you would say we would have to educate all persons involved: students, teachers, school employee, parents who are involved in that particular school district, to create a culture of it's about health. It's about saving not just your life, but someone else's, and vice versa if we wear face coverings. And then in other parts of other communities, it is, it's not your right to tell me what to do. And so that's going to be difficult in some parishes, we know and we understand. But what we would hope is that through education, through really using the best policies based on the medical professionals and healthcare professionals, that we turn that perception around as it relates to this mask being something that infringes upon someone's rights of liberty, so to speak. We've heard that the last week or so. So that is one that I think through education and through understanding, through examples of having people share their stories, I can say if you've not been touched by it as an individual, you may have a different respect for the virus. But when you have, and you've seen the true impacts of when somebody is brought into a hospital and you can't see them, and two things you'll see happen. They go into the hospital, you see them next being lowered into the ground, or you see them recovering and coming back to your family. And I've seen plenty of both sides of that. And so it's been eye-opening for me as a person. I've not physically experienced it myself, but I've seen where it impacted social communities and social clubs, and just my community in New Orleans, where you have one social club had almost 28 members pass away. And then you have family members. People have seen 4 and 5 and 6 and one family pass away because of COVID-19. And if you're in communities that don't see that and don't experience that, you may have a different perspective. But if and when it does touches your community, your personal family, it will certainly educate you quickly about the tenacity of this virus. And I would implore us to really think about how we do this for all of us, not just for ourselves. So as we talk about educating parents, students, and employees, we got to certainly spread that into finding the best practices, best policies that actually talk about safely reopening schools. And so if we have to push it back till September to do that, I think that's a great job. If we have to open schools up in certain areas that feel they have the resources necessary to do that, and they can prove that, and the parents and the teachers and school employees feel safe enough to return, I'm sure they'll be willing to do that as well, because we did see in a survey, there's quite a few people who would like to go back to school and be with their kids, and vice versa, kids be with their teachers. And nobody wants schools to be shut down. In fact, I don't think schools are going to be shut down. I just think they're going to be reopened in a different way. And that's really a hybrid approach, or that's through online learning for quite a few months until we can either get a vaccine or come up with some way to best protect us from this devastating virus.
Also, how can we you talk about the communities being uninformed. How can we inform the communities that's not informed?
It's through connecting with those organizations that actually impact and influence those individuals. The churches, the community groups, the teachers unions and school employee unions. I think churches will serve as a great house of knowledge and information when we start there too. Because a lot of people, and you'll see even in churches, speak against the virus being real. And if we can get inside of some of those and do an education, that would be helpful as well. I just think the more people we get the information to, and we're on one consistent path. And the problem we're having is at the national level, there's no consistency. While some is using it as a political conversation, others are using it as a medical and health conversation. And then when you get to the state level, you can see the pressure being applied to governors right now. And then governors are now making choices as they become hotspots, mandatory. And then you get to the local level, it becomes another political conversation that has to be health over people's lives. And it has to be about health instead of politics. And this is a health concern. This is a health issue. While people are playing politics with it, it really is about our health.
Thank you, Mr. Bell. We have our last few questions. Nancy Torradine, many states have decided today, like California and New York, are pushing back opening schools until cases are below 5%. Any word on Louisiana following this?
As of yet, we have not had those conversations. I know within our organization, I know there's people around the country that are having that discussion. I'm on national conversations, and I've heard that same maybe 3 or 4 states that was mentioned, and they're basing it on their states being hotspots, as well as just not having the funding and resources to open safely. And I can see in Louisiana that is bubbling up, and we're going to monitor that and keep that. And if our members and leaders and people in the communities think that it's too soon and too early, we'll certainly be right there pushing the issue to make sure that we put safety first. And so that's our take on that, that it is a discussion that's bubbling up nationally. I know in the state, I've heard pockets of that in different parts of our state, in different cities and different parishes. And so we're in some of those discussions, others we're not, but we're listening, and we want to hear. And that's why we thought this survey would be very important for us to help us really hear from people in different ways than pockets, but hear as many different voices than we will usually, most people go to their own constituency group and just stick with that. Well, we wanted to branch out and see if we can help amplify the voices of not just teachers and school employees, but also parents and those in the community who have the same concern, because this is an issue that impacts all of us. None of us are immune to it at this point. Until there's a vaccine, or there may be a few people, and you've heard it just recently, I heard it even yesterday, that they have some people who have caught the virus, returned back to normal, and then caught it for a second time because the virus has mutated. And so with information as quick as it is going, we have to always be abreast of that. And what's happening just in our state is not good enough. What's happening just in our country isn't good enough. We have to look at the entire world and the impact COVID-19 is having to find lessons that we can learn from each other globally so that we can get a handle on this pandemic.
Thank you for your question, Nancy. We have 2 more questions and then we're gonna cut it off for the day. Our second to last question is from Elise Corville. If starting later this year becomes the decision, would that affect the school schedule, meaning kids stay in school later?
I think what probably would happen is we would probably go to the governor and then go to the U.S. Department of Education and ask to waive some of those days and some of those requirements like we did once schools closed in March. So I think there would have to be some workaround in terms of with the governor, as well as him petitioning through his Louisiana Department of Education as well to the U.S. Department of Education to waive some of that so that we won't be out of compliance with state and or national guidelines.
And before we do our last question, I am resending the survey results report. Again, that will be available on our website, la.aft.org, later this afternoon for anyone that wasn't able to download it today. But our last question is from Joy Mead. Do we know yet a protocol for parents to follow when children are symptomatic? Will testing be accessible, and or will children need to quarantine? And what sort of system will be in place for keeping kids on track if a great deal of school is missed?
Wow, that's like 2 or 3 questions in one. I'll take the first part, and Cynthia, if you want to help me with the second part. But I can tell you there have been discussions about students who miss time. I know I was part of the Louisiana Resilient Commission that Governor John Bel put together. I was on the K-12 subgroup, and I know that conversation was had as relates to that. And I do know that students will have the same opportunity to get testing as well as quarantine and have to get released to return back. And then for missing those days, I think Heather alluded to a little earlier in our survey too, that we would hope that there's some distance learning that can take place once they're healthy enough to do that, to make up any lost time in terms of their educational experience.
Let me just piggyback on what President Carter said. As of right now, and this was discussed at the House Ed meeting this morning, Superintendent Brumley said that as of right now, there are no waivers for testing, for seat time, or anything like that. They have not addressed that yet. And so that, again, is one of the many unknowns. There are many things they could do as far as the Department of Ed or Bessie applying for waivers to the U.S. Department of Education, but that is something they have not started yet.
Thank you, Cynthia.
Okay, thank you, everyone. We really appreciate you joining us today. Again, we will be talking about these results for days to come, and the results will be on our website as well. So with that, thank you and goodbye.
Thank you, everyone. Appreciate you coming on and joining us.